This is Pushing Boundaries, a podcast about pioneering research, breakthrough discoveries, and unconventional ideas. I'm your host, Dr. Thomas Burney. My guest today is orthopedic surgeon Dr. David Hanscom, who started performing spinal surgery in 1986. I just want to introduce you, David, if that's okay, just a few words.
Absolutely.
Much of his practice was devoted to performing surgery on patients who had undergone multiple prior spine surgeries. Until the end of 2018, Dr. Hanscom was also co-director of Swedish Neuroscience Specialist Spine Fellowship, Swedish Medical Center, Seattle, Washington, and in Minneapolis. Since 2006, he has employed a structured spine treatment protocol evolved from his medical expertise and his own experience escaping from chronic pain. His book, Back in Control, A Surgeon's Roadmap Out of Chronic Pain, published in 2016, presents the foundation of the program. His website, drdavidhanscom.com, provides an overview of his efforts and educational resources. One more thing, David quit his surgical practice in 2019 to pursue teaching patients and medical providers how to solve chronic pain. He has advocated for well-documented and effective solutions for chronic pain that need to be brought into mainstream medicine. And this is the main reason that I have asked David to be a guest on this podcast, so he can talk about his ways of treating chronic pain. Welcome, David.
Thank you, Thomas. I'm delighted to be here.
So please tell us a little bit about your own experience with pain and how you beat it.
So with chronic pain, as you well know, that in medical school, we're not really trained adequately to treat chronic pain. We sort of have this concept as a structural problem, yet only 20% of physicians are comfortable treating chronic pain and only 1% enjoy it. So the reason for that is that we have the wrong paradigm. So I want the world to look at me not as a David Hanscom inventing some new ideas. All we have done is just mine the data, gone deeply into the research. So my whole hypothesis has been just implement what we know. And as you know, you and I are on the same mission. We're not making this stuff up. We just know what the data says. We know how the body works. We know that each person has a capacity to connect to their own capacity to heal. And the data is so deep. So I look at myself, so I went through a chronic pain myself for 15 solid years, maybe more than that. I developed 17 different physical and mental symptoms, and I didn't know what hit me. Most people would call it a burnout. And I had no idea what a burnout was, but I went from a absolutely fearless spine surgeon to crippling anxiety in 5 minutes. And once that hit me, I could not stop. So I developed migraine headaches, skin rashes, burning sensations in my feet, anxiety, depression, OCD. And so I was in that hole till about 2003. And I came out of it somewhat by accident, reading a book by David Burns called Feeling Good. And David Burns said, do these writing exercises. I go, okay. So for the first time in 15 solid years, after trying everything you can imagine, I'm a physician, I have access to everything, things started to shift. And 6 weeks later, I was much better. Then 6 months later, after I dealt with my anger issues, not very well, by the way, I started to heal. And my symptoms are gone. Every one of those symptoms is gone.
So what were your symptoms, apart from the migraine? But when you talk about chronic pain, like where was the pain?
So it's an interesting question. What is chronic pain exactly? So we have physical acute pain, which is a danger signal. And so usually I look in terms of what's called threat physiology, which is a fired up nervous system, stress chemicals, adrenaline, cortisol, inflammatory markers. And so your whole body's on fire, so you have multiple different uncomfortable symptoms. So migraine headaches, of course, is pain. Tension headaches, I had ringing in my ears, tinnitus, which was horrible, which, by the way, affects 50 million Americans. I never, ever thought I would get rid of the tinnitus. I was told by all the ENT specialists it was permanent. It is gone. I developed severe burning sensations in both of my feet. The tinnitus and the burning sensation started 25 years ago. So in my wildest dreams, I never thought that those would disappear. They're gone. I had stomach issues that would come and go. I developed one time some crushing chest pain for several months. That disappeared. I've developed a lot of mid-thoracic back pain. So I developed, again, we'll talk about this later, but it turns out that the mental symptoms have the same problems as the physical symptoms, that they're all metabolic inflammatory disorders. So I had extreme anxiety, major depression, a full-blown obsessive compulsive disorder, and I was absolutely suicidal. And in 2002, I tried to commit suicide. So I have 20 medical colleagues committed suicide, and I'm now convinced that it's the relentless anxiety that nobody wants to talk about that drives people to suicide. And so I have now a colleague, I won't give any more details than that, who's had some major hits, both on his career and on his personal life. His anxiety is through the roof. He's also a fearless surgeon. He can't sleep, and he is absolutely a mess. So when body chemistry takes off like a rocket, as a surgeon, I'm used to controlling things, right? So you can't control your body's let me say that. What we teach people to do is to regulate the body's physiology, but you can't control it, right? I mean, there's a difference between those two words. So for me personally, I have hip arthritis, shoulder arthritis. I have pain now, but I don't have the other physical symptoms. And these are from structural problems. But what I don't have is I don't have the anxiety. Huge difference.
So then what do you ascribe your healing to? How did you heal?
So what I now know, I did not know for over a decade what hit me and how I came out of it. It's only about the last 3 years I belong to a scientific work group that discusses this twice a month. So it turns out that symptoms are due to what's called sustained exposure to threat physiology or stress chemicals. And so it's like driving your car down the freeway in second gear. Your body's fired up, you're full of adrenaline, cortisol, those inflammatory cytokines, your metabolism's elevated. So you're just fired up all the time. So the essence of all chronic disease, by the way, is sustained exposure to threat physiology. The essence of healing is safety physiology. So I was raised in an abusive background, and we know that for humans, that mental thoughts are as much of a threat as physical threats. So I spent my life trying to outrun my past, trying to analyze things, try to fix it, lots of funny thought patterns, and you cannot outrun your mind. So the essence of disease is sustained exposure to threat physiology, and the essence of healing is safety. So I'll jump clearly into this story and work backwards just to summarize sort of how I healed, and I just didn't know it at the time, is I call it dynamic healing, whereas every living creature survives by, and you talked about this with your body's intelligence at the cellular level and working upwards, and that's why I'm so excited about having you on my podcast, because we have very similar views, and you and I both know the body's so complex that none of us can get really attached to anything. I mean, it's incredibly complicated. So my assessment in really simplistic terms is that you have your stresses or circumstances or your environment that you have to analyze and process in order to stay alive. Every living creature has to do this. So we gravitate towards safety and we avoid threats. As far as life, we're mandated biologically to survive, then pass our genetic code to the next generation. That's it. So every living creature, from a one-cell bacteria to human being, has this response. So you have your circumstances that are either safe or dangerous. You have your nervous system that takes all these signals in. It can be either calm or hyperactive. If your nervous system's hyperactive, it takes less stress to set off your fight or flight physiology. So then the final part is the output, or your body's physiology. It's either fight or flight or safety or rest and digest. So when you're in fight or flight, which is necessary for survival, by the way, you don't feel very good. And the sensation generated by that chemical reaction is what humans call anxiety. It's the same sensation that my cat has, but she doesn't have a word for it. So what happened to me is I thought anxiety was psychological. And I know I'm not against psychotherapy, by the way. So I want to be really careful what I say here. So I think that everybody has different ways of doing this, but it turns out that when you just talk about the problem over and over and over again and don't learn how to regulate your body's physiology, then it doesn't really help. I mean, psychology can be a huge adjunct to it. So the bottom line is dynamic healing. So you process your stresses differently, so there's less impact on your nervous system. You can increase the resilience of your nervous system. And then you can actually, through breath work and all sorts of different techniques, actually directly lower the physiology into safety. So with dynamic healing, we understand that the problem, the root cause, is this interaction between your circumstances or stresses and your body's ability to process it and cope with it, then your body's physical reaction. So when your body senses danger, you're in fight or flight. And so in medicine, we're treating symptoms, but say somebody comes to me with a stomach ache or back pain, and they're going back home into an abusive relationship, as you well know, that's threat. And the body's capacity to cope with that has probably gotten worn down over the years. And so the person's in fight or flight with lots of physical symptoms. One of the key issues that medicine doesn't seem to understand very well, but we did learn this in medical school, is that when in threat physiology, with adrenaline and cortisol and histamines and inflammatory cytokines, it translates into physical symptoms. So there's a diagnosis out now. Are you familiar with this term called medically unexplained symptoms? Have you heard this term before? Oh my goodness. Started in 2002 in the family practice world, and they developed a term called medically unexplained symptoms. And what they're saying is that, okay, we acknowledge you're suffering. We can't really find anything wrong. We'll do the best we can.
Isn't that the same as idiopathic?
Right, right. It's a terrible term. Started in 2002. So what it does, it takes away hope.
Mm-hmm.
And research shows that hope is actually anti-inflammatory.
Mm-hmm.
So now you have diagnosed, okay, now I have MUS, so what do I do? So they say the doctors tell me there's nothing wrong. Well, everything's wrong. Your body's full of stress chemistry. Every cell is bathed in stress chemistry, and everything's wrong. So, and then if you look at a car sitting on the street, if the car is broken for some reason, nothing happens until you turn the car on. So that's the physiology of the cars when it's running. Same thing with the human body. It's the physiology and the chemistry and the blood pressure and all these different things in your body that are incredibly intricate, infinitely more complicated than your car. But I don't know how medicine got down such a rabbit hole that everything's structural. I don't understand. We really did learn this in medical school. Correct me if I'm wrong on that. I mean, physiology creates symptoms. I mean, if your sodium's 120, why, maybe, of course, that's on a blood test, you find something wrong, but you can go unconscious. If you have an overuse syndrome and you start having a really bad tendonitis, there's no test that's going to show anything. So it's, quote, nothing there. Well, your tendon's inflamed as can be. You'd have to do a biopsy to actually see the inflammation, or maybe not even that. Anyway, I'm just saying that 90% of symptoms in the body are explained by the body's physiology. And again, what the research is now shown, again, this is not new news. Our group has been digging out. I'm sorry about that. I should have plugged the phone. Can I just take a break here for a second? Um,
No problem. No problem. So,
okay,
yeah. So, in terms of your background, you said that you come from a difficult childhood.
I did. My mother was probably a bipolar. She's probably psychotic, rageaholic. And of course, this is a very common story. So we had 4 children. My father was a physician. He worked about 100 hours a week. He kept changing jobs. I lived in 12 different houses by the time I was 18 years old. My mother never was happy anywhere, nothing we could do to make her happy. And so every time we would move to a small town, she would obsess about all the negatives in the town. She absolutely drove my father out of the town. So my father's a competent physician, very smart. He should have stayed in his original job, which was a country physician in Newport, New Hampshire. He was wonderful. And he just bounced and bounced and bounced the rest of his career. So we moved a lot. My mother would go into these rages that would last 2 to 3 days. There might be a 1 to 2 day break. Then she'd go back into a rage again. She would She would verbally abuse there's four of us. My second brother and sister got verbally abused the most. All of us got physically abused with a big 6-foot belt. And my father just wasn't home. So she wasn't mentally stable. And I do understand. I mean, she was a woman who is probably very spoiled as a child. She was not abused as a child, probably more of a narcissistic personality, really self-consumed with things. And she could not understand her needs. And, being essentially a single mother with 4 young children without any real emotional coping skills, it just put her over the edge. And she never came back. So I've long since let it go. Of course, you have to do that to heal. And I also understand that I feel sorry for her. She did not have a good chance at having a good life. She never really had a good life. So, but it was a very, very abusive childhood.
Mm. And your father was never there to protect you.
Now he's working 100 hours a week. And so he was a physician. And, he actually, listen, it was interesting. He actually went into counseling himself at age 90 because he felt so badly about how he had been with his kids. But of course, he was abused too.
Right.
So he said, I mean, he basically did the best he could do. So, I went through a phase, of course, in my 40s where I realized how much, if I had a wife at home who was abusing my children, I wouldn't let that happen. That just is not a choice.
But it's also probably a reason why he worked 100 hours a week.
Right, exactly. So, right. And so he's incredibly committed to his kids, and he did the best he could do. So he tried to help us cope with it with summer jobs and take us for hikes on Saturdays and Sundays. And so he did the best he could do. I get it. And, but no, he was abused also. So I mean, yeah, my mother just cut a huge swath of our family. What I didn't understand, though, looking backwards, is that my migraine headache started when I was 5 years old. Every 2 to 4 weeks, my entire life, I'd have these horrible migraines. And again, nobody could tell me what was going on. And so then a lot of people said, well, it's not stress. And I'd never quite agreed with that. So we now know with migraines, there's a whole cascade of inflammation, the permeability of the vessels changes in the brain, and it's basically threat versus safety again. And so my migraines are gone. They've been gone for 15 years. I never would have thought that either. The ringing in my ears, I did heavy construction work for about 20 years. I never protected my ears, which was unfortunate. So I do have a high pitch hearing loss. So I started with the ringing in about 1980, and I went to ENT specialist. I tried white noise, different medications, all sorts of stuff, and it just got worse. And tinnitus is a very, very annoying symptom. It affects 50 million Americans. I assumed I would have it the rest of my life, and it is gone. Never would expect that. In fact, a lot of people that go through the course that I put people through have the tinnitus resolve. So tinnitus actually happens to be something that is a symptom. I mean, as you know, when your nervous system is hypervigilant, it's hyperreactive, it doubles the speed of nerve conduction in the peripheral nerves. It actually causes inflammation of the brain with cytokines from the glial cells, and your brain's inflamed, your nerves are inflamed. So with the tinnitus, you're having now impulses coming in from your ears that ordinarily would not hit your consciousness. And so I just honestly never thought that tinnitus would go away. It's unbelievably disturbing symptom, and it's just gone.
Mm.
Burning in my feet started in the 1980s. I was training in Hawaii under a lot of stress at the time. I was just starting a surgical residency, and I just thought it was a hot pavement, never paid much attention to it. And God, by the time 10 years later, they were like on fire, and it wouldn't stop. That is also gone. I got skin rashes popped up on my entire body, off and on, all over my entire body. Those are gone. Now, if I quit practicing the tools I teach to my patients, my symptoms do come back in about 2 or 3 weeks. So all of a sudden, these little skin rashes will show up on my wrist, or my scalp will itch, or my feet will burn, my ears will ring. So I'll feel more anxious. I won't sleep as well. So again, all these things are a function of your body's physiology being in fight or flight. So I'd like to make one metaphor, which I think you'll resonate with. We all know about the ACE scores, the adverse childhood experiences. And if you have a score of 3 or more on a scale of 10, that you have a high chance of serious diseases, shortened lifespan, all sorts of stuff. And so they never really talked about in medicine why. Why would a high ACE score, which stands for adverse childhood experiences, cause a shortened lifespan? And so we know humans are programmed from birth. Your programming becomes your life filter that you process everything through. And so if you come from an abusive background, it's like a feral cat compared to a domestic cat. So I was that feral cat. So I was hyperactive, hypervigilant, on the lookout all the time. And I think, and I'd like to get your thoughts on this, that a lot of professionals, I can talk mostly about physicians, of course, they become, quote, successful trying to outrun their past. So I was so busy, so self-critical, so perfectionistic, and accomplished that I went to a major spine fellowship, became a major spine surgeon. So I was, quote, successful, but what's success? I was sick. I had 17 different symptoms. That's not exactly success. I lost a marriage, almost lost my life. So that's not success, I don't think.
No.
So, I mean, so I think burnout, I think that let me talk about physicians for a second, is that I think the essence of burnout is suppressed anxiety. I think that there's data showing that when you suppress unpleasant thoughts, it actually shrinks the hippocampus of your brain. It actually increases the size of the amygdala of your brain. And so you have structural changes occurring in your brain, and physicians don't want to talk about anxiety because we're supposed to be better than that. But it's a human trait. We all stay alive because of this fight or flight response. It's a gift. If we didn't have anxiety, we wouldn't be alive. So it's a million times stronger than the conscious brain. You can't control it. So the term I use is developing a working relationship with it, that you watch its powerful reaction protect you. And then human consciousness is only or less than 100,000 years old in the course of hundreds of millions of years of life. So emotional pain happens to have the same effect on the body as physical pain. Humans know how to physically survive, although a lot of it's dysfunctional, but we certainly have not learned to negotiate our emotional life. And it's just as treacherous or more treacherous than the physical threats. So it has the same effect. There's a book out. Are you familiar with Lisa Feldman Barrett out of New England? She wrote a book called How Emotions Are Made. Anyway, she goes into the neuroscience of consciousness, and her point being that thoughts and concepts become embedded in our brain, just like this chair or table does. So if you have a self-critical voice, I'm no good, I'm this, and this, that becomes your reality. So I used to say, well, thoughts are real because they create a chemical reaction in your body, but they're not your reality. After reading her work, I realized that I was wrong. That your thought and your concepts of your life, how you fit your framework into life, is your filter. So the data coming in, if it fits your filter, you accept it. If it rejects your life concept, most people just reject it. So once you have sort of a set view of life, if it's sort of negative, it gets worse with time and repetition. So with adverse childhood experiences, if you're that feral cat, things now appear to be dangerous that may not be dangerous because you're an adult. But when you were a kid, they were dangerous. But your brain doesn't know that. So again, going to the dynamic healing model, you have the input, the nervous system, and the output. And so this is where your work comes in in a big way, where you can't reconstruct you can't just fix the nervous system, you have to sort of rebuild it. You've got to teach that feral cat how to feel safe. And just talking about it's not going to really make that cat feel safe. So again, the essence of healing is learning to give your body cues of safety and allow your body chemistry to normalize. How's that for a very long answer for a short question? There's a lot of material to cover here. So, I mean, my main point being is that in medicine, the root cause is the balance between your circumstances and your coping skills.
Mm-hmm.
And then if you're not coping, then you're in fight or flight. And if you feel safe, it's fine. And so in medicine, we treat just the symptoms. When we don't treat the root cause, we're not solving your problem.
Feelings.
No preaching to the choir here.
Yeah. Well, no, because we got listeners. Feeling safe and feeling loved.
Right.
I would add love to that.
Right. So that's one of the essences of our work. So little different direction here, but love is a physiological state, right? When you're with love, you have oxytocin, dopamine, serotonin, growth hormone, anti-inflammatory cytokines. So when you are at play or connecting or feeling good about yourself and people around you, there's a profound effect on your body's physiology. We did workshops years ago, which I've not done for a while. They were 3 to 5 day workshops in Rhinebeck, New York, at the Omega Institute. And at every workshop, 70 to 80% of the people in severe chronic pain went to pain free. And
Mm.
we did not understand how that could happen. It happened every time. And I eventually realized that it wasn't me, but and I did not understand the inflammatory nature of threat versus safety. But we had a structure. My wife is a tap dancer. We had play. We had some education. We had lots of interaction. So the interaction, of course, is oxytocin, which is highly anti-inflammatory. We were at play, and people just started to laugh because we were doing crazy things like juggling scarves and cup songs and all sorts of stuff. So we're in a structure of a shared experience and just a profound effect on people's physiology. So we didn't know at the time. So I started the first one in 2013 with no expectation of anything happening. I was shocked. And when people go back to their environment, they actually go back to the triggers and go back to their pain, except the brain has tasted freedom. And at some tipping point going forward, many of them, years later, continue to thrive. So it's like connecting. So to me, love is about awareness and connection. And what you're doing, you're connecting to your own body's capacity to heal. Then you can connect with other people. Then you start a whole process going that is very, very powerful. But yeah, no, I agree 100%. Love is a key factor.
So I think on your website you talk about an action plan and
Right.
the journey. What does DO stand for?
So it stands for direct your own care. And it turns out that there's 3 parts to healing. The first one is understanding the problem. With any realm, whether it's building a skyscraper or buying a car or making decisions about business deals, you have to understand the nature of the problem. So awareness is the first step. So you become aware of the nature of chronic pain. You become aware of your own situation in relationship to chronic pain. And by the way, as a surgeon, I was always very, very careful to make sure that there was not a structural problem. I didn't assume anything. So you want to become aware of the nature of chronic pain, your situation, but also the nature of the solutions. So there's an education homework process that's very important. The second part is that chronic pain is complicated. And what we tend to do in medicine is throw simplistic solutions at a complex problem. And so the second aspect, you have to deal with every aspect of it at the same time. So it sounds impossible, but it's not. So chronic pain, there's sleep, there's stress, there's medications, physical conditioning, diet, all sorts of things come into it. But if you look at it in an organized manner, they can all be dealt with. And so it's like fighting a forest fire. When you're fighting a forest fire, it takes multiple strategies to contain a forest fire, and everything counts. Same thing with chronic pain. You can't just treat, they say, well, I tried mindfulness, that didn't work. Well, it can help. I get better sleep. It didn't work. Well, it can help. So it's always 3 to 5 things that a given person does that helps get them better. Then the final step is you have awareness. Then you have to deal with every aspect simultaneously. Then the third part, which is absolutely critical, is the patient takes control. Because each person is infinitely different. If you came to me with chronic pain and I spent hours and hours with you every week to help solve your chronic pain, I couldn't do it. Nothing would happen. So once a person understands the concepts and internalizing it, then taking their version of healing, what you're really doing is connecting to your own capacity to heal. This is not magic. So the doc journey, so it stands for the direct your own care journey, is essentially the third edition of my book, and that I now understand the physiology that I did not understand before. And so the first thing we do is get people really just to calm down with simple writing exercises, relaxation exercises. Sleep is a big deal. And then we have an interesting concept that came out of our workshops, is that if you're in my office, I would say, Thomas, look, you've been in chronic pain for 10 years, you've been seeking medical care, and you've probably been talking to a lot of people about your pain. When you walk out of the door of my office, you will never discuss your pain ever again with anybody. Period. No exceptions, no, period. You can tell your doctor how you're doing for a minute, but you're not going to talk to your families, friends, colleagues, anybody about your pain or medical care. And by the way, since we think mental pain is a bigger problem than physical pain, that means no criticism, giving unasked for advice, malicious gossip, complaining, that comes off the table. Because how does it help to actually calm down your nervous system if you're maliciously gossiping about somebody? It doesn't. You're firing up your physiology. So it's not fair to the person that you're gossiping about, of course, but it really is not fair to you either because you're actually firing up your body's physiology. So that's the starting point. So you get people to get their nervous systems calmed down a bit. Then we go into the nature of anxiety, being physiological state. Then the middle step, which is really critical, is awareness. So anytime you're anxious or frustrated, your body has sensed threat. Something in the present has reminded you of something from the past, and you've lost awareness. You're actually in the past, you're not in the present anymore. So by definition, if you're feeling anxious or frustrated, you've lost awareness. So the key to human relationships in life is awareness of your needs and people around you. When you're anxious or frustrated, it's about you, and you've lost that awareness. And so what's ironic about the human existence is that in the animal kingdom, there is no rewards for being vulnerable. You don't survive. So same thing in the human world, the mammals, if we are physically vulnerable, if we do really risky things, we don't survive either. But again, we haven't learned how to negotiate our emotional landscape very well. So they showed out at UCLA that emotional pain is processed in the brain is the same way as physical pain. And so people don't want to, so emotional pain hurts. And why do we want to feel pain? We don't. So we suppress it. Again, like I said before, that thought suppression actually decreases the size of the hippocampus, which is the memory center. So suppressed thoughts and emotions are a huge problem for humans. It has tremendous effects on our physiology. Humans cannot escape their thoughts. So every human being has some level of threat physiology on a constant chronic basis. Now, if you're that feral cat from an abusive background, of course, that's worse. Or if your stresses are overwhelming, that's a big problem. So it's a solvable problem once you understand how to regulate the body's physiology, in that you can change the way you process input, you can increase the resiliency of the nervous system, and you can directly lower the output. And I realize I'm being repetitive here a little bit on purpose, but it's called dynamic healing. And once people understand the process, it's not very hard to do. So it was called the DOC Journey. It's a computer-based program with 7 legs that again goes through the simple steps. It goes through anxiety, then awareness. Then the next step is anger. And so the antidote to anxiety is control. When you're trapped by something and have no control, your body kicks in more stress chemicals and you become angry. Every person that's truly healed, and people do go to pain-free, by the way, it's always around anger. And again, I had no concept of what anger was. My version of anger that got me sick was I was a perfectionist, very self-critical. Well, it's not very nice, right? I'm not very nice to myself. And somehow in medicine, we think perfectionism is a virtue. So high standards of performance is one thing, but being endlessly self-critical and pushing yourself to do better is actually not helpful at all for your health. Right. So I got sick, badly sick. So perfectionism was probably the one thing that got me in more trouble than anything, but it's a form of anger. So once people learn how to process anger, and that's a different topic, that's when the healing starts. And it happens over and over and over again. I have one little website post I wrote. One guy, it happens all the time where people say, well, who would have thought it was the anger? So again, when you're angry and frustrated and trapped, your body's physiology is off the charts. And why would you not be angry when you're trapped by pain? Nobody's telling you what to do. Nobody's telling you how to get out of this mess. And I can't tell you the desperate emails I get every day, people asking for help. And if I can just get them to engage, it's a very consistent process. Within usually 6 to 12 weeks, people start getting better. Then it doesn't stop. Once you sort of change the way you start processing everything, you continue to get better and better and better. So people really thrive at a level that's unbelievable. I have one gentleman who had 28 surgeries in 20 years. He's now been pain-free for 5 years. I just got an email from him yesterday that he's just simply never felt better in his life. So I would have thought after 2 or 3 surgeries that it becomes much harder to get better. It doesn't matter. You can reprogram your brain around anything.
So do you see your patients personally, or or is it done by emails, or how do you deal with people in pain?
Well, again, even when I was in practice, I haven't been practicing now for 3 years. So it is helpful to have a health coach or somebody like yourself or somebody like me to help people along. But when they came into the office, I mean, doctors shy away from chronic pain because we don't want to get dragged into all their issues. You don't have to.
Or
We,
they give them painkillers, which are all habit forming and addictive.
right. So we're doing the wrong. So the problem, I'd love to have another podcast with you, really blunt about this, about what the business of medicine has done to us. The number one thing that is a factor, I mean, I have my techniques and structure. It's not magic, it's not self help. It's a set of concepts that you can apply to your life and help yourself heal. So the doc journey is a set of concepts. It takes you through a sequence, but everybody does it differently. We'll often layer on different somatic therapies and EMDR and other things to do in addition, but it gives you a great foundation to do this on your own. So I have all sorts of emails from around the country, people who have done the course on their own, never talked to me, and they've gone from miserable pain to pain-free. And it happens all the time. So this isn't, so again, once you understand the basic principle of how the body runs, and you learn to, what's the word I want to use? It's not control, but learn to regulate your body's chemistry. Remember, stress isn't the problem, it's a chemical reaction to stress that's the problem.
Hmm.
And so as you learn to regulate your reaction, symptoms start to disappear. So yeah, I respond to emails as best I can. I get a lot of them. I do part of the doc journey. Again, I urge people not to spend any more than about 15 minutes a day on it. It's like learning how to play the piano. You can't read my book, you can't read the doc journey and just heal. So you have to become, I use a term, you have to become a professional at living your life. That means you become very skilled at processing anxiety and anger, and you become very skilled at nurturing joy. And so if you're trying to nurture joy to compensate for the anxiety and anger, that doesn't work. That unconscious survival response is 1 million times stronger than the conscious brain. So there's a set of tools. You learn how to empirically process anger and anxiety. I call it developing a working relationship with them. And then once you've separated your identity from this survival reaction, people thrive at a level they never knew was possible, including me. I mean, I'm not trapped by anxiety. I have pain from my shoulder and my hip arthritis, but I don't have the anxiety. And so I'm not trapped anymore. So yeah, I've got to live a life at a level I never thought was remotely possible. And that's what happens. People start to thrive at a very high level.
Is there a patient that you can look back on in your life? Is there a patient who changed your life?
Well, it's interesting. One of my best friends who's been with me on the project for a while says, I'm simply inspired by my patients. But um, again, probably well over 2,000 people have gotten better. So each story just blows me away. And I'll tell you one in 2013 that really caught my attention. Her name was Esty. I talk about her all the time. And she was about 32 years old at the time. She came to the Omega workshop. She had 4 years of really severe neck pain and headaches. She describes it as a hatchet in the side of her neck. And she's seen 10 physicians, undergone 6 injections into her neck, was on high dose narcotics, had physical therapy, and just kept getting worse and worse and worse. So she came to the Omega Institute, and this is my first one. She's holding her neck. She's looking at me. I'm looking at her. I'm going, well, I'm not sure what we're going to do here. I'd never done a workshop before. So my idea, I was just going to go ahead and just give her it's like a long lecture series, but I didn't realize people don't just change with lectures. So my wife happened to be there doing things like the cup song, vision boarding, all sorts of other things. We did lots of sharing. And Dr. Luskin, a friend of mine who wrote the book Forgive for Good, was also part of the workshop. Anyway, in 1 week, she went to pain-free. Done. And it took her, by the next year, she was off narcotics. And at 1 year out, she's completely pain-free. And she has 2 of the most beautiful kids you can imagine. Unbelievable. They're now, I think, probably 5 and 3. So this is 2022. And so she, again, illustrates that once you've changed that way you process your life in general, you continue to get better and better and better and better. So when you internalize it from the beginning, the process keeps working. So pain clinics work, by the way, but it's like a structure imposed on you, and you come outside the structure, people go back to their patterns. So the fun part about this is that, again, people, once you change, including myself, that once you cross that threshold, you like keep changing in a positive direction, essentially indefinitely. So she got married about 3 years after the workshop. She had two beautiful kids. She's been off. She just doesn't have pain. It's just really a wonderful story. This other gentleman, 28 surgeries in 22 years. I mean, he, again, same thing. And what he did not realize, in spite of everything he'd been through, including a major suicide attempt, he did not connect with his anger. I mean, really, after 28 surgeries, he just was not connected to his own anger. And within 2 weeks after he connected to how angry he really was, and started I don't like the word letting go, but started a process that his symptoms resolved in about 6 weeks. Then he read my book, he did the doc journey, kept getting better and better and better. He now exercises every day, spends time with his grandchildren, back doing his business, and just living a normal life. That's 28 surgeries. I did not think that was possible.
That's amazing. How did he, you said when he connected with his anger, how did he do that?
So what happened, he was on such high dose narcotics that he wasn't thinking very clearly. So he had a major suicide attempt down in Southern California, and they detoxed him. And the physiatrist down there kept saying, "Why are you so angry?" He goes, "I'm not angry." And all of a sudden it hit him like a huge block of bricks. And within 2 weeks, things started to change. And about that time, he read my book, Back in Control, and just went through a huge transition over about 6 weeks of just coming right out of the hole. And he actually, about 2 years ago, had some neighbors cut down some trees, which really pissed him off. And he went back into the hole. I said, "Tom, you can stay there if you want, but you're going to get sick." And guess what? He did. He got an eye infection, had surgery, got infected again. And I didn't say I told you so, but I said, "Tom, you can't stay fired up and angry without a consequence." So anyway, he's fine now again. But again, the process is dynamic healing. So remember, anxiety and anger are there every day. It is a necessary part of your life. So I use the term become a professional at living your life, which means you become very adept at processing anxiety and anger. With the first step being aware you're angry. I wasn't even connected to my anger. Then the other step of nurturing joy is actually a skill we're not really taught in our lifetime. We're taught to survive and get along and have a good time. But nurturing joy is actually a skill I don't think very many of us were ever taught. So that's where the healing really occurs, is that you move away from the anxiety and anger, which is the pain, and you start nurturing good food, good wine, good friends, spiritual journey, love. All those things change your brain and body's chemistry, and it's a profound shift in quality of life. And that's why I quit my practice to do this, because what we're doing in spine surgery is badly damaging people, as you well know. And I'm watching all hundreds of people go to pain-free, and I couldn't watch it anymore, so I quit.
Well, you're doing amazing work, amazing work. I think that I wish there would be more people like you in the world, but at least we have you, David. So,
Well, I mean, your work is also phenomenal. I mean, we're basically on the same pathway. I mean, I just think that, I mean, my whole thing is probably not gonna happen in my lifetime, but I mean, I just think that collaboration is all we can do. I mean, trying to change people's minds by pure data doesn't work. And so just by being persistent and collaborating, like, I'm delighted to meet you. I'm delighted with your outlook. I'm delighted with your work. And so, yeah, I'm looking forward to seeing what we can do in the future, collaboratively to move this whole process along. Because I feel like we're messengers. I mean, right?
I agree. I agree. Hello?
Yeah, no, I'm here.
Okay. Well, we need to come to an end here. So thank you for joining us, David. Needless to say, this was totally fascinating. I wish you continued success in all your many enterprises. To my listeners, I say make sure you visit Dr. Hanscom's podcast called Dynamic Healing, co-hosted with Dr. Les Aria. You will also find it jam-packed with invaluable information. Also, his website is a treasure trove of fascinating blog posts and guidance. So thank you so much for joining me. And I just want to say that my guest next week will be not a doctor, no, just a person, Daviar Snipes, who is Director of Equity, Diversity, and Inclusion at the Stratford Festival in Stratford, Ontario, which is where I live. Another fascinating person with a very interesting background. So once again, David, thank you so much, and let's stay in touch.
All right, Thomas, thank you very much. I appreciate the opportunity to share my ideas here.
Enjoy the rest of the evening. Take
All
care.
right. All right. Thanks a lot.
Welcome. Thank you.